If you suffer from chronic back pain, you are not alone. Whether you were injured in an accident or everyday activity, it's estimated that as many as 80% of Americans will experience a back problem at some point in their lives. Joining me now is Dr. Richard Carpenos, the owner of New England Spine and Disc, and his patient, James Henneberry. Nice to have you both here. Welcome back, doctor.
Great to be here. Thanks, Teresa.
James, you had the procedure with Dr. Carpenos, but let's go back a couple years. What initially made you visit Dr. Carpenos?
Well, I've had chronic back pain for probably 30 years, and 10 years ago, it got so bad that I finally had surgery on my back. I had a spinal laminectomy with fusion on, I think it was L4 and 5, with screws and pins and so forth.
That's big time surgery.
Yes, it was, and it took. It's a long procedure to get back to normal.
A lot
Probably
long recovery.
A year.
Is that right?
Yeah.
And did you find any relief with that?
Yes, I did. I've been good for probably 10 years, and then last year, just about this time, I could feel it coming back on above and below where the surgery was in my back.
Was it from an injury initially, or just progression
I
of
think
life?
I think it's just the composition of my spine. You know, I have spinal stenosis, is what it is. So.
And doctor, what were your first diagnoses when you met with James?
So, once you have a fusion surgery, you've changed the anatomy of the spine forever. You've actually created like a Jersey barrier down there. The two vertebrae are now screwed together. There's a cage holding it together. It creates functional instability. The spine becomes unstable above and below. As you get older, arthritis tends to set in. He has stenosis, which is a narrowing of the canals where the nerve travels through. That narrowing is so painful, you can't walk. Even walking from here to the mailbox, your house to the mailbox, can cause tremendous pain. And these folks have to sit down, and then the pain goes away, and then they walk a little bit. It's a nightmare.
And do you see a lot of patients that already had surgery come to you?
Half our patients have had surgery, and unfortunately, it's a temporary fix in many cases. In some cases, the pain doesn't go away at all after surgery. And the good news is, with what we do, it's not surgery. So even if you don't have the best success, although most people do, you can always opt to have surgery. But once you've had the surgery done, it's a lot harder. He was a really challenging case.
Sure. We're going to talk a little bit about the treatment. Actually, we have some video that you could walk us through so we know what we're looking at here.
Yep. The first thing we're doing there is the laser, and that is a magnifying ball at the end of this laser, which is driving a very high frequency of light deep into the tissue. The light being delivered to the damaged cells and diseased cells creates a production of energy in those cells and allows them to reproduce at a very high rate. It also helps to close down the pain gates. It oxygenates the blood. It reduces inflammation. It's extremely effective in regenerating tissue. It could be used on back problems, neck problems, shoulder pain, knee pain, carpal tunnel syndrome, plantar fasciitis, TMJ. It has so many applications. It's ubiquitous in just about any soft tissue malady, and it will regenerate the cells and get you better without any invasion.
And you can actually demonstrate for us right now.
We can. Yeah, so this is the applicator head, and this is the instrument, and we basically just, you'll see this light. If I demonstrate it on Mr. Henneberry's arm here, you'll see, I don't know if you can see that light. You can see that light that's going in there. And the only thing the patient may feel is a slight warming sensation as the energy heats up some of the blood in the area, but basically it's the light that does the healing. It's very similar to photosynthesis, where the light is stimulating the production of energy in the cells of the plants. Here, the light stimulates the production of energy in the cells of the damaged tissue. It feels really great, and after several visits, most problems completely disappear. And you know, he could tell you about his success with this. It's been incredible.
Obviously painless, James. You're not feeling a thing, right?
No. You know, I think I had a total of 32 treatments, which was this plus the spinal decompression machine.
Right.
DRX 9000, I think it is.
Yep.
And the combination of the two, I didn't feel any immediate relief. I think I went like my 22nd treatment, and he was so positive he kept saying, hang in there, you're going to get better. And I was very skeptical.
Wow, but finally it did,
But
right?
all of a sudden, I went home after that 20-second treatment and was waiting for the pain to kick in about 3:30, 4 o'clock in the afternoon. And then at 6 it didn't.
That's
and at
great.
8 it didn't. And I went to bed. I woke up the next day. I felt pretty good. And then every treatment after that, I felt better. So,
fantastic.
and it's been a year, and I'm still feeling good.
So happy to
Knock
hear
on
that.
wood.
There you go. And James mentioned spinal decompression. Why don't you
Right.
break that down for our viewers?
So here, basically, if you look at this model of the spine, this is what a disc problem looks like. Obviously, we like to get it before the surgery, and then it's much easier than Mr. Henneberry's case to get better. So we draw the disc space apart using a very sophisticated instrument at half the body's weight, 18 times in a half an hour. And each time we do it, the disc material works its way back into place off of the nerve. Obviously, as the mechanical irritation on the nerve goes away, the pain goes away. But the nice thing is this is living tissue, Teresa, so it actually heals once we open up the space. So it's like you have a bulging tire and the weight of the car pushes the tire
sure.
bulge out, but then if you jack the frame of the car up, the bulge reduces. The problem is as soon as you lower the weight back down, the bulge comes back out.
And that is the piece of equipment that we're talking about here.
Correct. There it is on the video, and you can see that gentleman being lowered down. It's very comfortable. Patients fall asleep on it. There's no downtime. You can go right back to work after this. And it varies on the seriousness of the condition or the length of time you've had it and also your age, but it's appropriate for anyone with a disc problem, sciatica, lumbar disc herniation, facet syndrome, post-surgical syndrome, even fusions, which is probably the worst case we've seen, fusion surgery. They can also get a great response. You just have to be patient.
Sure. And James, are you still going for treatments?
Occasionally I go for just a
touch-up.
just a touch-up, just a
That's great.
tune-up.
Very good. And Doctor, you have some special offers?
We do. All Connecticut residents, we'd love to have them come by to see the equipment and test drive it. So you can get both the laser and the spinal decompression 2 times, totally free. All Connecticut residents, 2 free visits. Just call us. We're at 1-800-PAIN-FREE or 203-799-3472. And we'd love to have you come by. We'll schedule you. You can have 2 free visits.
That's great because you really do get patients from around the state.
Everywhere. My average patient travels over a half an hour to get to my practice.
Very good. Well,
He comes from Madison.
he does, right?
Yeah.
All right, let's put that info on the screen there. New England Spine and Disc is located at 391 Boston Post Road in Orange. You can call 1-800-PAIN-FREE or visit newenglandspineanddisc.com for more information. James, happy to hear you're doing well.
Thank you very much.
Doctor,
Yeah,
thanks
doing
for
good.
being here.
Thank you very much.